Hello, this is Benjamin Domb at the American Hip Institute in Chicago, presenting our study on inline pullout strength of two acetabular fixation methods for ligamentum teres reconstruction of the hip, a cadaveric study. My disclosures and those of our authors are listed with the American Academy of Orthopedic Surgeons. Ligamentum teres reconstruction may be an appropriate alternative in select cases of full thickness tears in cases of hip micro or macro instability, especially in the revision situation. The technical variations in ligamentum teres reconstruction fixation at the acetabular fossa are critical to understanding how to achieve the best functional and biomechanical results. The pathoanatomy of teres has been described in multiple studies. Here we see some visualizations of the ligamentum teres where we see its attachment to the transverse acetabular ligament as well as the base of the acetabular fossa. And note that it does attach right to the base, right beneath, right overlying the transverse acetabular ligament. Our group and several others have published on the surgical techniques for ligamentum teres reconstruction, as well as the biomechanical role of the ligamentum teres and its reconstructions. We've proposed a technique that involves a drill tunnel through the femur and transfemoral access to the base of the acetabular fossa, such that we can access that very base where the correct footprint of the ligamentum teres should lie. Here are some pictures of a reconstructed ligamentum teres, which we see on the left under good tension. And on the right, we can see the diagrams of the reconstruction methodology. Note that in the top middle diagram, we create a double bundle ligamentum teres reconstruction concept. And in this diagram, one to the right, we can see that that double bundle is based right over the transverse acetabular ligament, so that there are dual points of fixation with dual anchor fixation on the acetabular fossa with this particular technique. And an internal brace can be added to the fixation. The MRIs at the bottom demonstrate post ligamentum teres reconstruction outcome. The purpose of this study was to compare the pullout strength of two different graft fixation methods used for ligamentum teres reconstruction on the acetabular side. In 7 cadaveric specimens, the acetabular socket was prepared after the native ligamentum teres was transected and the femoral head was removed. 7 separate tibialis anterior grafts were then prepared by suturing a running, locking number 2 suture on each tail of the graft. 3 specimens were prepared with a suture button. The remaining 4 were prepared with a knotless suture anchor. Specimens were then mounted on a custom jig with a mechanical test frame to allow for the inline pull of the graft fixation construct. Following preload, each specimen was loaded to failure at 0.5 millimeters per second. Stiffness and ultimate pullout force were measured for each specimen construct. The results showed that the suture button fixation had the greater mean ultimate load compared to knotless suture anchor fixation. There was no significant difference in mean stiffness between the two methods of fixation. Different methods of ligamentum teres reconstruction techniques have been reported with variations in graft options and choice of fixation mechanism at the acetabular connection point. Currently, the literature lacks quantitative biomechanical data favoring a particular method of graft fixation at the acetabulum during LT reconstruction. This study is the first to our knowledge to perform a comparison of pullout strength between two different methods of acetabular-sided LT graft fixation. The suture button fixation demonstrated greater pullout strength compared to the suture anchor fixation with a peak corkscrew. The results of this study may guide further decision-making when selecting an acetabular fixation method for the ligamentum teres reconstruction. In conclusion, the cadaveric study here examined differences in pullout strength between two methods of graft fixation that may be commonly utilized in ligamentum teres reconstruction. While suture button fixation demonstrated greater pullout strength and required a higher load to failure, this is still a work in progress and additional technologies are emerging for suture anchor or all suture or knotless fixations on the acetabular side for ligamentum teres reconstruction. Thank you very much.